Hello, and welcome back to Afro Mosaic, the global Black lifespan journey. Today, we're doing something a little different. We're putting a system on trial. And our focus? It's right here in Ontario, Canada, where we're going to dig into this huge gap in the global Black experience, that massive chasm between the promise of good health and the actual reality of care.
So if you think about it, Canada's healthcare system, it's really built on this incredible idea, right? Universal care. It's supposed to be based on your need, not how much money you have. It's a core part of the national story, this idea of equality for everyone. But, and this is a big but, for Black communities in Ontario and really all across the country, there's a serious disconnect between that promise and what they live through every day. Let's really get into why that is.
Okay, so this really gets to the heart of it. This is the one question that's going to drive everything we look at today. We're not asking if the promise breaks down. We know it does. We're asking where and how it breaks down and what that actually means for people across their entire lives.
All right, so before we can really dissect the breakdown, we've got to start with the promise itself. What does the system say it's going to do? Let's take a look at the official language, the commitments that are right there on paper.
Now look at this. This comes directly from Ontario's own lawmaking, the Connecting Care Act. It legally says, mandates, that the entire system should be guided by a commitment to equity. So this isn't just some nice idea or a friendly suggestion, it's literally the law.
And it's not just that one law either. This promise is backed up by a whole ecosystem of policies. You've got the Anti-Racism Act, and Ontario Health has its own framework that specifically calls out the need to tackle anti-Indigenous and, importantly for our conversation, anti-Black racism. So, the words are all there. On paper, the intention looks crystal clear.
But here's the pivot. This is the crucial turning point in our whole investigation. We see the official promise, written right into the law and policy. The big question is, does any of that actually translate into real protection and fair care for Black Ontarians?
You see, this gap, this chasm between the promise and the reality, it's not just happening because of a few bad apples or some random isolated incidents. No, it's the product of a system. And that system has a very clear signature: systemic racism. So let's be really clear about what we mean when we say systemic anti-Black racism. We're talking about a whole system of inequities in power, in resources, in opportunities that is just deeply embedded in Canadian institutions, policies, and everyday practices. It's not about one person's prejudice. It's baked right into the structure of things. And a lot of the time, it's totally invisible to the people who aren't being targeted by it.
And that's the thing about systemic racism. It's not just one single moment. It's more like a series of hurdles, of barriers, that pop up at every single stage when you're trying to get care. It starts from the moment you try to get an appointment and follows you through every step of your medical journey.
And this right here, this is what it looks like in real life. This account from the community just makes it so clear. This isn't just a theory. This is the lived reality of being turned away from preventative screening, even when you have a family history of a disease, all because of a doctor's bias. And a single moment like that, it can have absolutely devastating consequences down the line.
You know, all those individual barriers, those moments where someone's pain is dismissed or a diagnosis is delayed, they don't just vanish into thin air. They stack up. They accumulate over an entire lifetime, and they carry a really heavy physical price.
And there's actually a really powerful word for this physical toll. It's called weathering. Think of it like this. The constant, chronic stress of navigating a racist system is like being caught in a storm that never ends. It's not just mental. It literally wears down your physical health over time, causing your body to age faster and putting you at a higher risk for all kinds of diseases.
And here's how that weathering actually unfolds across a person's life. The risk begins right at birth, with Black mothers facing much higher risks. It carries on into childhood, where we see overrepresentation in systems like child welfare. Then it just compounds in adulthood, leading to higher rates of chronic diseases tied to stress, like diabetes and hypertension. And the tragic result of all this? A shorter life expectancy.
I mean, if you want to understand just how serious this crisis is, just look at this number, 21.65. That is the increased risk of dying from HIV/AIDS for Black women in Canada compared to white women. That's not just a disparity, that is a catastrophic failure of our public health system. There's no other way to put it.
And this isn't just a one-off problem. We see this same clear pattern of higher mortality risk across so many major diseases. For Black men, it's a 33% higher risk of death from prostate cancer. For Black women, a staggering 78% higher risk from uterine cancer. This data is telling us a very, very consistent story of systemic failure.
So here's the really crucial takeaway. What we're seeing in Ontario, it's not some isolated problem. It's actually a mirror that reflects a systemic nationwide issue. These outcomes aren't random accidents. They are predictable. And if something is predictable, that means it's also preventable.
And let's be absolutely crystal clear on this point. Race is not a biological risk factor. It doesn't determine your health. Racism does. These health gaps are not because of genetics. They are the direct, measurable consequence of a social and political system built on historical and ongoing anti-Black racism.
Okay, so we know the problem, but just knowing isn't enough, right? The real question becomes, how do we actually fix it? And the answer, really, is about a fundamental shift, moving away from all the empty promises and beautiful language and moving towards real, concrete protection and accountability.
Think of it as two different paths. On one side, you have the path of promises. It's filled with familiar words like commitment and frameworks that, let's be honest, often end up being shields for doing nothing. But then, on the other side, you have the path of protection. And this is where the real work happens. We're talking equitable funding for Black-led health organizations, true community governance, and solid mechanisms for accountability. That is the shift we need to make.
And look, this diagram, it's actually from Ontario Health. It shows exactly what a real, holistic system is supposed to look like. It recognizes that health isn't just what happens in a doctor's office. It's about housing, it's about education, it's about jobs, all of those social determinants of health. To get to true equity, you need a system that connects all of these dots.
So what does accountability actually look like on the ground? Well, it means putting communities in control of their own health data. It means getting real resources to the Black-led organizations that are already on the front lines doing the work. It means getting rid of these one-size-fits-all funding models that just don't work, and instead building real, tough accountability mechanisms right into the system itself.
When it comes down to it, the end goal isn't just about reducing a few statistics or closing a few gaps in the data. It's about achieving what's called health sovereignty. That's the right and the real ability for Black communities to control their own health destinies, with the resources and the support to truly thrive. And that leaves us with one last massive question. Are our systems actually ready for that kind of fundamental shift in power? So yes, this is a system on trial, and I think the evidence speaks for itself. To keep following this investigation and to be a part of building the solution, please take a moment to subscribe to AMHG Magazine and visit our website at amhg.ca.
Thank you so much for joining us for this explainer. The conversation doesn't end here, and neither does the work. We'll continue mapping the global Black lifespan journey together.